A lot of us have a rosy and romantic idea of what it means to become a therapist and to be a therapist, especially undergrad psych majors. I feel like a lot of us think that becoming a therapist means that we're listening to people's problems, we're giving advice, and we're solving those problems with the client. But that simply isn't the case. I learned a lot in my ethics course in my master's program, and whether you're planning to become a therapist or you're just curious, here are some things that they don't tell you about becoming a therapist. In New York State, at least, a lot of it should be very similar across the country, but state laws do differ. The power and the rights of the client. What does that mean? First of all, therapy isn't giving advice. And to illustrate why, I'll give an example. So let's say you're seeing a client named Gary, and he's madly in love with a woman. Very obvious to you that this relationship is a toxic relationship. Let's say the woman he's obsessed with, let's call her Sarah, right? Sarah is using all of his money. She's stealing his credit cards. She's gambling the money away. She doesn't appreciate him at all. She doesn't love him. She's not loyal to him. She's wasting his money, and she's basically using him. You can't, as a therapist, say, you gotta leave Sarah. Gary, what are you doing? She's ruining your life. If you tell Gary to leave Sarah, let's say I tell Gary to leave Sarah, then let's say Gary divorces Sarah, right? He gets severely depressed, and then he takes his own life. That's on me, because I told him to break up with Sarah. I told him to divorce Sarah. His family can sue me, so that was dark. But on the bright side, therapy is also things that we didn't imagine it was before. For example, we can help our clients with immigration paperwork, or connect them to institutions and lawyers, and help them with other problems that can make their life easier. So like if our client has 2 children that go to different schools, and that's picking them both up is very difficult for them, and administration won't really allow our client to transfer the kids into one school, we can reach out to the principal and we can advocate for them in ways like this. The role is a little more versatile than we realize, but the client also has a lot of power. And by that, I mean, for example, we can't impose our values on the client. We can't tell our client what is right and what is wrong. Let's say our client wants to have an affair, right? We can't say, whoa there, buddy, back it up. You're already married. What are you doing? Are you out of your mind? We can't even say, don't do it. Even if we think and we strongly believe that having an affair is a bad thing, we can't communicate that to our client. We have to explore the client's options. Like ethically, we have to explore the client's options. Ultimately, the client is deciding what they want to do. That decision might not line up with our values, but ethically, it's about what the client wants and not what we want. We're just going to support the client form their goals. And that's kind of a bitter pill to swallow, or at least it was for me. It's this concept called ethical bracketing. Basically, what that means is we're taking our values and we're placing them in like a box, and we're trying to toss that box as far away as possible. There can be a lot of tricky situations in therapy in which the client might choose to do something that doesn't line up with our values. This is an extreme example, but let's say the client is in chronic pain and the doctors can't do anything for our client. Now the client decides that, let's say it's a she, right? Let's say she wants to end her life through medication. So basically it's called like assisted suicide, when you reach out to like a physician and you want them to administer like a lethal dose of some type of medication just to end their life, basically to put them out of their misery. If you don't agree with suicide, we can't tell the client to just not take their life. We have to explore their options, and we can't steer them in the direction that we want them to go. Ethically, we shouldn't. And if you see a client on the intake form that they filled out, something about them, their identity, whatever it is, right, their race or something, right? Let's say you notice there's a value difference or something very different about the client that you don't like, you're not allowed to refer the client out based on that value difference or that difference. Because if you do, you could get a malpractice. You can get into trouble for discriminating against your client. And then the next thing that they don't tell you is confidentiality can be tricky. You can't reveal that you're seeing Linda, for example, in therapy to anybody else. You can't tell their boss, their coworkers, you can't tell their husband, you can't tell anybody. You can't tell the teller at the bank when you're depositing the checks. Especially if you live in a rural area and most of the people in the town know that you work as a therapist, you might run into a lot of people and you can't spill the beans. You could get into trouble if you do. And it gets even trickier with minors. We're talking about mental health counselors. For school counselors, it might be a little different. For MHCs, right, for mental health counselors and like other counselors, right, psychologists, ethically, your responsibility lies with the minor. Legally, your responsibility lies with the parents. And now that might come into conflict. Let's say now the parents ask you for some information. Let's say they ask you, what's going on in therapy if the minor is taking any drugs, for example. Now, what do? You have to weigh the factors. So let's say the minor is taking drugs, a strong pharmaceutical drug, for example, and they take it with alcohol and they end up dying, but you don't tell the parents. When they asked you, you didn't tell them that the minor was taking drugs. Now the client is dead and it's on you. The parents can sue you for not telling them that information. On the other hand, let's say the minor tells you that they're taking drugs, but they don't want you to tell the parents. And let's say you do tell the parents in secret, but then the minor finds out. Now the minor is upset, and now they might not even come to therapy anymore, because now they won't trust you with any information anymore. There's a way to work around these, but I'm giving you like the wrong steps and the wrong conclusions here. But you want to balance the ethical and the legal responsibilities as well as your relationship with the client. And if you do break confidentiality, that is a lawsuit. Speaking of lawsuits, there are ways that you can get sued. In addition to not protecting your client from danger, a minor, and giving bad advice and referring them out because of a value difference, there are a few more ways that I compiled from my notes, and here they are. If you abandon your client, so let's say you terminate therapy prematurely, or they're going through something very difficult and you go on vacation, you transfer them to another therapist. They could sue you for abandoning them. They were going through the loss of a loved one and you just threw them away. If you depart from standard and established therapy practices, so you're doing something that's not in the literature, that's not been tested or written about, then you can get sued. Sexual misconduct. You can get sued for having relationships with your clients and their family members. Not allowed to do that according to the ethical codes. One of the more common things that therapists get sued for, which is kind of weird. Practicing beyond your competency. Let's say that you don't have experience treating clients with severe schizophrenia or neurological damage, right? And you do, and you don't do so well. The client could sue you for practicing beyond your scope of competency. Repressed or false memory. So apparently you can get sued for making clients believe that they had a memory or something happened to them when it didn't really happen to them. This sounds like something out of psychoanalytic or psychodynamic orientation. Maybe a client tells you a story and then you basically assume that somebody abused them and make them believe that somebody abused them when it didn't really happen. They can sue you for that. It sounds very strange, but if you know anything about psychoanalytic theory and the emphasis on childhood experiences, I can see this happening. And you can also get sued for failure to assess and manage dangerous client. This is pretty self-explanatory, but that's rough. Hopefully you're starting to see that therapy is a little more complicated than maybe you previously thought. Therapist, CounterTransference, and well-being. So you're in therapy, you're seeing a bunch of clients, and you're hearing their problems day in and day out. And these are complex problems, There's drug abuse, there's loss, there's abuse, there's unemployment, and emotional problems, not feeling loved, loneliness, depression, anxiety. And you're hearing all of these problems. Countertransference is when the therapist has a reaction towards the client or what they're saying. Let's say that a client reminds you of someone that you really like. Now if you're not careful as a therapist, you might be less likely to challenge them. You might be less likely to ask them the important, tough questions that they need asked. You might be less likely to be straight with them and tell them what they really need to hear because you're afraid of hurting their feelings. You're afraid of being disliked by them. You want their approval. That's an example of transference getting in the way. Another example is if you really dislike a client, subconsciously they remind you of maybe a controlling family member or someone who used to bully you in school. You're in session, you're seeing that client face to face. You have to manage those feelings on the spot. Outside of therapy, there are ways to manage. Many recommend that a therapist go have their own therapy so they can talk about these problems to someone else. Because of confidentiality, you can't really tell other people about the client and the problems you face. There are going to be all sorts of people with all sorts of personalities, and if you don't manage your own problems and your own kind of family relationships, it could end up hindering your actual work. I've heard a lot of undergrads say that, I'm in this class, I'm majoring in psych because I'm interested in depression or bipolar disorder, and because I have the disorder or I have depression or someone in my family does and I just want to understand it better. That sounds noble and that sounds great. But at the same time, if you don't manage the problems within your family, if you don't manage your relationship with that family member or with your own depression, it can come up, especially if you're seeing a client with bipolar disorder and they remind you of your sister who has the disorder, or of your own depression. Because when you're in a training program, you're being supervised, you're seeing a client, your supervisor is basically responsible for gatekeeping the profession and making sure that only competent therapists who can manage their own feelings, emotions, and their own well-being can go on to become therapists. Only competent students, right, can become therapists, because they have a responsibility to future clients, not to let chaotic and disorderly students become therapists. And that's one of the things that they're going to look out for: the students' own self-management, their own well-being. A lot of these problems come up: substance abuse, broken families. And if you don't manage these problems, your supervisor will definitely see it. And they have the power to suggest that you take a semester or two off because your well-being just isn't there. Your mental health just isn't there. They can tell you to retake classes, and worst case scenario, they can dismiss you from the program. Again, I don't say all of this to discourage people from becoming therapists. I just want people to understand that it's more complicated than people realize. I don't want people to have an idealized and rosy vision of what it means to be a therapist. Yes, it's a beautiful profession and we do help people. But at the same time, it's very draining and it's a lot of work, and there are a lot of ethics and laws that go into it. You're dealing with real people and real problems. These aren't just case studies anymore.